My name is Alison Seitz, and I'm a stroke neurologist at UW-Medicine. So as a stroke neurologist, I generally see patients when they first come in with symptoms of an acute stroke. That's, a stroke in the first few hours or in the first day. And I try to figure out what's the first and second and third thing that we should do to help those patients and hopefully make sure that their stroke isn't as bad as it could be. Or if they're not having a stroke, figure out what else might be making them have those symptoms. And then after that, we try to figure out why it happened and how to make it so that they never have a stroke again. I'm especially interested in stroke in women, especially stroke in women who have obstetric or gynecologic comorbidities. And what I mean by that is women who have had a stroke in pregnancy, or women who have stroke risk factors and are interested in becoming pregnant, or women who have had preeclampsia or other hypertensive disorders of pregnancy, which can affect long-term stroke risk. And then there's also the entire spectrum of gynecologic disorders like endometriosis or migraine related to menstruation, which also can impact stroke risk. At UW-Medicine, we see over 1,000 patients with stroke annually. So we see really a lot of people from all over the Pacific Northwest who have symptoms of stroke. Because of my interest specifically in stroke in women, I see a lot of women who have had strokes in pregnancy or who have predisposing factors in their pregnancy that might lead them to have strokes and help them to prevent that. A comprehensive stroke center is a center that has all of the available ways that we have to treat acute stroke and also to figure out why people have had strokes and treat those underlying problems. So that means that we have access to medications that are clot busters that we can give people immediately when they walk through the door. It also means that we have access to thrombectomy. That's an interventional procedure where the vessels in the brain are opened up. And then we also have access to all of the different diagnostics that we use to figure out why somebody's had a stroke and then intervene upon that particular problem. At UW-Medicine, we have a multidisciplinary care model, which means that I, as a stroke neurologist, work with neurosurgeons and neuroradiologists, in addition to neurologists from other specialties, and nurses and physical therapists and occupational therapists to try to provide the best possible care for our patients.